Hello and welcome to The Insider. I'm Lisa Adams. Welcome to our viewers and to our listeners on the radio. We continue today with our COVID-19 focused editions of our program, and today it's all about public health and the strategies that Erie County has been employing since March to contain the spread of the virus. My guest is Melissa Lyon, Public Health Director for Erie County Department of Health. Welcome.
Thank you.
So we're a couple of months now into Erie County's response to COVID-19. Let's talk about where we are right now in terms of the County Health Department's top concerns. Where are you putting your focus and your energy right now?
So our focus really has remained with containment of disease, and we do that through our notification of positive COVID-19 patients and their contacts. That's one main focus. We've not strayed from that. The second focus is really helping businesses understand their role, whether they're open, and then what precautions they need to take in order to remain open and serving our community safely.
Yeah, we have four bullet points that we can take a look at here. These are some of the key things that you've talked about that you're doing. One thing is good communication with the public. And certainly we've seen the county executive almost every day talking to the community. So talk a little bit about, the other things, coordinating resources, monitoring trends, contact tracing, but talk a little bit about that idea of talking every day, the county executive addressing the community, how you decide what the emphasis of the day is going to be, and really how that's changing from moment to moment.
Yeah, thanks. It's a great question. We've been working incredibly closely with the county executive and her administrative team around the most important talking points that we want the community to hear. So 8:15 every day we have a briefing. Then I do meetings throughout the morning, and then at noon we do another briefing about anything that may have changed or helping her put together what she'd like to be talking with the community about. So we're in communication multiple times a day. We end our day with another call about 4:15-ish, 4:30, and that really drives our messaging. The things that we want, where we're talking to the community through a less formal, is our phone line and our phone system. We have a call taker system. It's very busy. We've had over 100 calls in one day, and then I'd say average is between 40 and 50 calls a day that we're getting around businesses. And then there's also clinical calls, and those can range from a similar range from 70, around 70 calls a day. So with that being said, that's more of our informal communication. And then when we send our teams out into the community, that's either following up with a business, following up to a complaint around a business, doing surveillance in the community. So we talk to business owners, we ask them how they're doing, what they need help with, where they're having trouble meeting the compliance of the order. So there's a multitude of ways we're communicating with the community.
We showed a little video as you were talking there of, I think, day one when you announced Erie County's first case. And there you are from the health department standing next to each other without masks on. How things have changed just in a matter of weeks here.
Absolutely. I think, early on masks were discussed, and the guidance at that time was masks were not useful for those of us that were either asymptomatic or not a healthcare worker. So the mask conversation has changed dramatically, and I'm very pleased that we've moved to a universal masking system that says, my mask protects you and your mask protects me. And if we're able to embrace that new behavior, I think we can make some strides forward that will be very helpful for us getting back to what I would like to refer to as maybe a new normalcy in a pandemic.
You've educated all of us that Erie County is one of the few counties in the state that does have a health department. I think I just assumed that every county had a health department, so that was surprising to me. So how have you brought together a team that's making decisions and crafting messages here and staying abreast of what the guidance is every day?
Yeah, so we have 72 to 75 employees on a regular annual basis, and we've augmented that by a handful of others, whether they have been employees that we have borrowed from the library system, or we've brought back some retirees, as you may be familiar with. So we augmented the quantity of staff we had available. And the beauty of having a health department is we have a direct line to the State Department of Health, and then we can respond to that guidance within basically the same day or next day of receiving that guidance. And also, when we get laboratory results around COVID-19, we can start our contact tracing almost real time. The same time the provider is notified, we begin to contact that person and start that process. So there's very little delay with the communication and or follow-up with COVID-19 patients.
And Melissa, let's talk about those early days. The county was the filter for who could get tested, and you had to check with the state epidemiologist. Were we behind the curve, or was it good that we had that filter system until we learned more about the disease?
That was a lot of work in the beginning to filter through those that were most eligible for testing. That was really occurring throughout the country in that same systematic order, because commercial laboratories were not up and running with testing. And so most of them were state-run public health laboratories. So we were sort of the gatekeeper early on. There was a lot of hard work through that and learning to develop our systems. We were extremely grateful when commercial laboratories were up and running, because there was then no reason to have to ask the health department, does this person meet criteria to be testing? The physician then was able to make that decision directly. So more samples were submitted for our county fairly quickly.
Well, you've made it clear that contact tracing is really key, but how will that look as the county inches toward reopening? We're going to talk about that when we come back. Stay with us. I'm Lisa Adams. Welcome back to The Insider on TV and on the radio. We're talking about the strategies that Erie County is employing to contain the spread of COVID-19. I'm privileged to have as my guest Melissa Lyon, Public Health Director for the Erie County Department of Health. So contact tracing, it's a vocabulary word or two that we're all learning here. How big of an effort has this been? How time consuming, how effective in your view? And how much more are we going to need going forward?
Yeah, so it's really fun to watch the general public learn about epidemiology and what we do every day in infectious disease and communicable disease tracing. This is what we do to stop the spread of all communicable and infectious diseases. So it has taken a significant amount of work. We've basically re-established or redeployed all of the public health nurses to be trained in doing COVID-19 contact tracing. As you can imagine, each disease requires a specific way that we ask questions. And so they've all been trained, and they all are on a rotational basis. When positive cases come in, they're assigned to a case, and first call is to the known positive. And from that known positive, they talk to us about how many people they've had close contact with. And there's a definition. It's within 6 feet for 10 minutes or more, without any types of protections. And we get the contact information for them, and then we begin to call those individuals, inform them of their potential risk, and then what's required of them for the next 14 days, which is what we would call a quarantine. And they have to self-monitor, they have to stay within their home, and then if they develop symptoms, they're to call us. So they receive a letter with this information. It's kind of a signed contract that says that they've read this, understood it, and they agree to it. We're going to need to continue to do this for a long time, especially if we open up our businesses and start to move around more. The virus is going to look for its next host. That's what it needs. That's what it wants. And if we can continue to contact people quickly, get their contacts, let them know that they have potentially been at risk, we can contain this. We won't stop the spread entirely, but we can contain it. And containment is so important.
How scared are people when they get that phone call? Do most of them know that maybe they've been in contact with someone who was positive? Are they surprised? And what role does, I mean, a nurse obviously has to be educated and factual about the virus, but I assume there's a bit of hand-holding going on here as well.
Yeah, I was just talking the other day about how important the relationship the public health nurse creates with that known positive, because we need to get as much accurate information as we can from that person, and it often takes multiple phone calls. Answer the question about the person that receives the call that says, hey, you've been a close or contact to a known positive, I think we have some that are often very surprised. I think we have some that may not be as surprised just because that's their temperament of like, well, the disease is here in the community, it was bound to happen. But our nurses are so well trained in having those interviews and keeping them calm. We do this often, as I said before, for different types of infectious diseases. So they're very reassuring in their conversation with those individuals.
So talk about technology, privacy, all these kinds of things. I mean, the more we open up and stop staying at home all the time, the harder it's going to be for people to remember where they were, who they talked to, how long they were with somebody for 10 minutes. And so I would imagine our phones all help us know where we've been. You can sort of use your phone to see where you've been. But is Erie County using technology at all in this? I mean, we're hearing about what Apple may do, or allowing people to know if a COVID-19 patient is somewhere around them. Are you using that right now, or are you just trusting people's word and their memory?
So how I'd like to answer that question is we're using very much traditional contact tracing methodologies. Sorry, it's a tongue twister. And so that really is phone calls, asking questions, and then probing them with additional questions to jog their memory. We have certain things that we ask. It might be, have you been to the grocery store in the last 7 days, or have you seen a family member? So we sort of prod them a little bit along the way of what the questioning is. We may also tell them, like, take a look at your phone, see if anything on your phone would remind you of where you've been. Did you take photographs, anything along those lines? But as far as formally using data that's collected by our devices, we're not there yet. As public health practitioners, we're very curious and interested to see what will come out of other countries that have used that. I look forward to what that could be. We know that Google Analytics is often used to identify potential areas that might be experiencing, let's just say, gastrointestinal disease, because people are Googling that in a particular area. So we know that data has validity for decision making. We've not deployed it here for Erie County.
So when you ask people to sign off on the fact that they're going to quarantine for 14 days, is there anything punitive you can do, or can you tell if they didn't do that? And is 14 days enough? Because I've heard some accounts of young people on the news who, walk us through the disease, the illness, and sometimes, it comes back in the middle. They start to feel better, they think they're doing okay, and maybe they're talking about day 16. So how do you deal with that?
Yeah, so to answer the first question about 14 days, we are very confident from our scientific knowledge around the disease that they may be symptomatic beyond 14 days, but the virus itself should have been in what we would call a state that is no longer infectious. So the science behind it proves that the infection period would be within those 14 days. So that's when you would begin to get sick. But if you get sick on day 14, those symptoms can go beyond that. So if that makes sense, the 14 days are the incubation period. So if you're sick on day 14, then it just depends on how quickly you can recover. It's approximately 7 days, could take longer, 7 to 10 days. So that's how that works. Remind me the second part of that question.
Are people cooperating, and do you know if they don't?
Yes. So I'm happy to report most everyone is and has been cooperating. They want to do the right thing. The few times we may have been reported, and believe it or not, people are reporting if they see people in the community that they believe shouldn't be. We have a method that we follow up with them. We give them a phone call and we visit them. And we go over the letter with them again and make them understand. And sometimes it's just a communication. They didn't quite fully understand what was expected of them. And then we just do a few drop-in checks to make sure that they're still staying compliant with that requirement. So we do have a mechanism to make sure people comply.
All right, I think we need an hour to talk to you, so we're going to take a break here and talk when we come back about the inconsistencies about what's essential and non-essential, a hot topic around here, even resentment about it, and that's next. Stay with us. Welcome back to The Insider. I'm Lisa Adams. It's all about containment strategies for COVID-19 here in Erie County with my guest, Melissa Lyon, Public Health Director for the county. So essential versus non-essential, this statewide closure process, did counties have input into that, and have the decisions been right in your view?
So, to my knowledge, counties were not included in the decision making. That guidance came directly from the state health department, working with the governor's office and releasing it through that mechanism.
So a lot of people seem to be frustrated about these inconsistencies. You know, how come that guy can be at work and I can't be at work? Some people thinking that way, and then other people are glad that they're home and they're worried that other people are out there. So you're interfacing with the public every day who's reporting somebody they think they're doing something that they shouldn't be. We had an example of the auction, the big auction at the Erie County Fairgrounds last weekend. So talk about how you deal with, you guys have to navigate those decisions that were made.
Yeah, it's been interesting for us to take a look at that guidance. I think it's been hard to say that one size fits all, and I know that that would be easy if it could be done, but it wasn't. So with that being said, we've been working with the constraints that we know from the guidelines and then helping those that can be open function in a way that's safe. The auction, I think we had a lot of conversation around that on whether we agreed or disagreed, but we knew that they had been given a waiver. And because they had been given a waiver, we said, well, it's our responsibility to make sure we can help them operate as safely as possible. And when I say that they did a really good job, I believe that that is true. The reports were very positive. But that's not a guarantee that disease was not spread amongst the group that maybe been attendees. I've said it's a sneaky virus. It's looking for its next host, and a large gathering is where that could potentially happen.
So talk about your teams that do go out and investigate things. Will you need a lot more help of that kind as our county starts to reopen, because I assume businesses are going to have questions about how to do it safely?
So we're trying to do a lot of work right now early on that's going out and educating large corporations, those that are currently operating, and then we're going to prioritize, because resources will be limiting. We'll prioritize where we go next, and it's probably going to be a very aggressive education on the front end, hoping that really works well, and then follow up for compliance and hopefully have less of that. But it's still a strategy under development right now.
We know a lot of businesses are working and considered essential, but I think a lot of attention was paid to Wabtec just because it's such a big company. And again, there's anxiousness among some union employees, and then others are, it's not that big of a deal. So when you have two different viewpoints of people who are going to be working side by side, obviously, you know, a lot of tension bubbles up. So talk about that as an example of a large company with a lot of people that your team worked with, and you know, how you felt when a case did develop there, and how that's going forward.
Yeah, so I think that every large company that is still able to operate and has a lot of employees is doing their very best to comply and do it safely. Just some of the design before a pandemic, we wouldn't have known that we had to design our workspaces where people could be 6 feet or further apart. It's just not part of what we were doing as a country, as a world. So we're having to work with the constraints that we have. I think it was to public health practitioners, we all basically have this understanding that it's a matter of time when you have a lot of people gathering, that the virus is going to find its way into that population, which really circles me back around to working with the businesses on the containment piece. And I am very happy to report that every business that's had any positive employee has been working very well with us to protect their employees and prevent the spread. So sanitation of the facilities and so on and so forth.
Last quick question on this topic. I think people are so fatigued because you hear completely different things in the same day. On the day that we're taping, I'm hearing some grocery stores are thinking maybe of not being open at all, just doing everything curbside. At the same time, there's so much conversation about, well, we can open up if we all get our temperature taken and have a mask on. So the food supply, these meat packing plants, that's an issue that's all across the country now.
Yeah, so it's been one of those, I don't like to talk about building the plane as we fly it. I like to say it's a half-baked cake. it seems a little bit more palatable. So I think a lot of us are putting the ingredients together that says what works best for our service, what works best for what we're trying to accomplish for the community as a business, and let's do it the safest way possible. I think everyone's really trying to make that happen. You know, we have to keep our food supply open. We know that if without food, that's a whole nother level of health issues that we don't want to have to be dealing with. I'd love to just say, let's focus on this virus. Let's keep it contained. We'll work with our businesses and then begin to open up this economy in the safest way possible.
All right, when we come back, masks, antibody testing, and big events like sports, we'll talk about that next. Welcome back. My guest is Melissa Lyon, Public Health Director for Erie County. So moving toward that May 8th date Governor Wolf is talking about, is that the right time?
I think as public health practitioners across the state and the country, we are a little concerned that it might be too early, but we're going to work with this directive right now.
We're hearing about antibody testing and plasma maybe helping people who do have the virus. Is that here in Erie County yet?
To my knowledge, it is not here yet. If it is, it's on a very small scale. And if and when we have that testing, the guidance will be so important with how we use the results of that data.
And testing right now, everybody seems to talk about that as if it's the panacea. Do you still think testing should be for symptomatic people?
I don't think there's any risk in opening up to people that think that they may have been at risk but are not symptomatic. I don't think I'd like to open it up to individuals that have been doing a very good job staying at home and have a very low risk because we don't have widespread testing yet.
So you mentioned earlier about the pivot on masks. Are we going to be wearing masks forever? And what about big events like Seawolves or the Erie Philharmonic? Will we be able to get back to those in time, and how soon?
So I think that you're going to be seeing universal masking for a longer period of time than may feel comfortable for people. But we might get to a place where it then becomes the new behavior, and you will be seeing people attending sports and large events wearing masks. It potentially could happen.
So we have on the screen here, if people have questions or need guidance, call 451-6700 or use that ecdhinfo@eriecountypa.gov. We're to the last question here. So what does keep you up at night when we think about reopening Erie County? And if you could tell people one important thing to remember, what would it be?
Yeah, so public health is about preventing injury, illness, disease, and premature death. And the thing that keeps me up at night is being able to prevent premature death because of COVID-19. So it's so important that we wear our masks, we do our practicing, our social distancing, good hygiene, and we're in it together, and we'll get through it together. That I promise you.
Proud of Erie County?
So proud of Erie County. Doing great work. I think the numbers reflect that, and everyone should be proud of how hard they're working.
Well, we certainly appreciate you, Melissa, and the work of your team keeping us informed and abreast of what's going on with COVID-19. And we do thank you for taking your time to be with us today. And for all of you watching and listening, thanks for being with us as well. If you have an idea for us to explore on The Insider, just email me at ladams@wicu12.com and join us again next time for The Insider.